Growth hormones are being administered to young children in an effort to enhance the growth patterns of those who are expected to be shorter than average. As a mother of a shorter than average son, I can relate to the pros and cons of HGH, also known as human growth hormones. My son has remained below average on the growth charts for his height, but I believe that HGH have more bad qualities than good. It is important to understand what HGH is, the uses and abuses of this hormone, and the side effects that follow the usage. We should not only care about our own health and well-being, we should also care about the health and well-being of our children. We know the importance of making sure that everything our children consume has a positive and non-detrimental effect. It is my intent to educate and persuade you to use HGH, not to use HGH for children. We all need to know more about this topic in order to be the voice for children everywhere. First, I would like to begin by defining what growth hormones are. According to Wikipedia, HGH are a peptide hormone that stimulates growth, cell reproduction, and cell regeneration in humans and other animals. HGH produces by the pituitary gland spurs growth in children and adolescents. Synthetic human growth hormones were developed in 1985 and approved by the FDA for specific uses in children. Naturally, some people have lower levels of HGH than others, but that does not necessarily mean you are a candidate for HGH. It is a natural occurring substance in the body on its own. HGH is a substance. It is in your body from birth, and it is at its highest level of production during your adolescent years. You will have the most amount of HGH in your body between 12 and 25, and then it comes crashing down at a rate of about 14% every 10 years. There are 3 forms of HGH, which you may know or may not know. It's through injections, sprays, and by pill form. Going back to the homeopathic HGH, it has been shown that it isn't a very effective way to receive the HGH benefits according to hgh.us.com. Knowing more about the history of human growth hormones will help you to understand why the cons outweigh the pros. This really is a dangerous drug, and knowledge is power. Next, let's talk about the uses and the abuses of HGH. In children, HGH injections are approved for treating short stature of unknown causes, as well as poor growth due to a number of medical causes, including HGH deficiency, Prader-Willi syndrome, an uncommon genetic disorder causing poor muscle tone, low levels of sex hormones, and a constant feeling of hunger, chronic kidney insufficiency, children born small for gestational age, Turner syndrome, a genetic disorder that affects a girl's development. Growth hormones are also used in abusive ways. The most common use for HGH are not FDA approved. Some people use this hormone along with other performance-enhancing drugs such as anabolic steroids in an attempt to build muscle and improve athletic performance even in young athletes. Nevertheless, some people obtain injectable HGH from doctors who prescribe it for off-label purposes, which is not FDA approved. That is so scary. Companies that market these products on infomercials or online claim they turn back your body's biological clock, building muscle, strengthening your immune system, and parents are giving these forms to children. Last, are you ready to hear the side effects and other hazards that come with the growth hormone? Here are just a few. Swelling due to fluid in the body's tissue, also known as edema, nerve, muscle, or joint pain, carpal tunnel syndrome, numbness and tingling of the skin, high cholesterol levels, cancerous. HGH can also increase the risk of diabetes and contribute to the growth of cancerous tumors. That's right, I said tumors. Furthermore, if you get the drug illicitly, you may not know what you're really getting. Because of the high cost, HGH drugs have been counterfeited. According to Mayo Clinic, leukemia has been reported in a few patients after treatment with growth hormones. These are just a few side effects from HGH. In conclusion, knowing more about the history of growth hormones, the uses and abuses, and the side effects of HGH can better guide you on whether or not you feel that hormone is worth using on your child. Before you decide to give your child a growth hormone pill, injection, or spray, due to your own personal vanity, think of your child's future. Could this pill potentially set your child up for cancer, diabetes, high cholesterol, or nerve pain? Personally, I would rather have a shorter than average child than a child fighting cancer or other illnesses. Knowledge is power. Understanding more about HGH is key to whether or not the results are ultimately beneficial. Thank you so much for your time. I have attached a PowerPoint presentation that may help you better understand HGH and why it is not good to use on children. Thank you.